Good evening and welcome once again. Today is our 1533rd webinar. Today's our guest is Dr. Samir Chaukkar. He's MD in homeopathy. He's a dean in Dr. Bhadra's Academy, and he has experience in with many colleges in India and abroad. And he has conducted numerous seminars in homeopathy in Australia, New Zealand, in Canada, USA, Belgium, London, Turkey, and many other countries. And he has his postgraduate diploma in addiction treatment from Canada, and he got graduation from MD, PG in Preventative from London, and he has teaching experience, and he's practicing homeopath, and he was associated with Bhadra's homeopathy for last 10 years. So I'm inviting Professor Dr. Samir Chaukkar to IFPH webinar. Sir, you are welcome, and we are very happy to invite you. Thank you, sir. Please, you're welcome.
Thank you, Dr. Ajani, and good evening, everybody. And I was just getting ready for the seminar, and I could, Dr. Dhanesh and Dr. Abdul Salam were keep calling me. They thought that probably I will not come, but Dr. Dhanesh and Abdul Salam, I will come. Don't worry, I will not go away anywhere because teaching is my passion, and for teaching I can travel anywhere in the world. So why not for all of you, right? So the most important thing of teaching what is required is passion. So I'm really happy that Dr. Mridul Sani is there today. Respected sir, Dr. Sinha and all the senior professors are here.
Dr. Chaukkar, can I request you to come in the Hindi session also? Because I know that you speak well. So I invite you to the Hindi session also.
Sure, sir. I will come.
Yeah.
आपके होते हुए मैं क्या बोलूंगा, पर बोलने की कोशिश तो जरूर करूंगा.
नहीं, बहुत अच्छा बोलते हैं आप. बॉम्बे के हैं तो हिंदी अच्छा बोलते हैं जी.
जरूर. So today my topic is little different from homeopathy because we have been all talking about homeopathy and things in homeopathy, and I have been practicing homeopathy for the last 30 years. But what I have gained in the last 10-15 years is a very valuable thing, and that is a knowledge of batch flowers. I got introduced to batch flowers many years ago when I was teaching in a homeopathic college, and I was intrigued by the peculiarities of the batch flowers and how they target particular emotions. Okay. So at that time, when I was teaching, I also wrote an article on homeopathic analogs of batch flowers. So I found out that every batch flower has certain homeopathic analog within it. So whenever we are practicing homeopathy, I started also using batch flowers. Okay. So today I will share my presentation with you here for everybody. Ajini, are you doctor?
Yes.
Can I call you Dr. Ajini?
Visible.
Yeah. Are you able to see the presentation, ma'am?
Yes, sir. Patch flower remedies introduction.
So after writing that article and after using these batch flowers every day in my practice, I could see that not only my homeopathic practice excelled, but also the quest for similimum, which was always there. Many a times after taking the case, I was lost. I did not know what to give in homeopathy. At that time, the batch flowers came to my rescue. And after giving batch flowers for a week or 2 weeks, when I saw the patient again, I was surprised that the picture was more clearer and I was able to give homeopathy in a much positive manner and more confident manner. Many a times, even after giving the batch flowers, I did not feel the need to give homeopathy because even major problems like migraines, major problems like ulcerative colitis, arthritis, they got healed by batch flowers. Which takes us to the main contrast of batch flowers, that everybody, when they talk of batch flowers, they say that they are good for mental emotional problems. I strongly disagree with it. Yes, they are good for mental emotional problems, but if somebody comes to us with a physical problem, Will you not give batch flowers? We will give batch flowers provided the person talks about certain mental emotional qualities, mentally emotional symptoms. How do you feel? What brings you here? How can I help you? What is the main concern of your life? These are the questions that I will ask, and I will get some mental symptoms. I may not look at the physical problem. He has arthritis, he may have migraine, he may have sinusitis, he may have vertigo, but I will choose certain batch flowers based on his mental emotional state. And I'm sure, and I've seen in my so many years of practice, that batch flowers can also heal, just like homeopathy. So now God has given us something along with homeopathy. And Dr. Edward Batch, he himself was a homeopath, remember. And he wanted the basic philosophy of batch flowers, according to Dr. Batch, is that keep it very, very simple. Don't complicate it. What has happened with homeopathy is we see so many schools of homeopathy blooming like mushrooms everywhere. Everybody has their own school. I am sorry to utter some words like Dr. Shankaran. He was my teacher. He is my teacher still. Dr. Vijaykar is my teacher. But now what has happened? Shankaran school, Vijaykar school, ICR school, Kolkata school. But homeopathy was supposed to be very, very simple. Dr. Hahnemann wanted it very, very simple. That's what he said in the first aphorism. The high and only mission of the physician is to restore the sick to health, to cure as it is termed, not to make big theories. But what is happening today in homeopathy is exactly the opposite. Thank God we have batch flowers. Not many people are using batch flowers, so there is no complications of batch. They are very, very simple. I am sure all the learned doctors who are attending today's session, they know about batch flowers. So I'm not going to talk anything new about it. But I will talk about the points that have helped me in my practice, that will help you in your practice, and I will have to learn also from you. Okay. So let's start with the presentation today. Dr. Edward Batch, he was a conventional doctor. Remember, he was a qualified medical doctor. He was a surgeon, and he was called in World War. Remember, during the World War, soldiers used to come injured from the battlefield, and he was a doctor who was looking after them. He noticed one thing, that those soldiers who had a positive outlook towards mind, which we all agree now, towards life, they healed much faster than the soldiers who were tired, who were sick, and who were, depressed about their illness or depressed about their injuries. They would even die of their injuries. But soldiers who had their limbs cut, who had severe injuries, who had a positive outlook of life, would always survive. And the healing also used to be very, very fast. This is what he saw. So Dr. Batch noticed that soldiers with injuries did not always recover in the same way. He wondered why. On further observation, he realized that the two other factors was personality and emotional state of the injured man, which we also agree. In between, there was a pandemic of AIDS. Remember, many people suffering from AIDS, HIV, they thought it was a death sentence. People used to die just when they were told that you have got HIV, you have got AIDS. And some people got depressed and their lymphocyte count would dash down and they would die very, very fast. Some people said, okay, so what? HIV and AIDS, I'm going to live. I want to live. And they kept living, remember. They could live more than a person who died later of a heart attack or diabetes, remember. So Dr. Batch, since he was a homeopath, he could find out the relation between the personality and the emotional state and how quickly he could recover. Those with optimistic personalities and positive emotions were more likely to recover well. In 1920s and 1930s, this theory was, kind of dismissed by medical professionals as irrelevant in recovery from illness. At the beginning of 1930, Dr. Batch became disillusioned by conventional medicine, just like our Dr. Hahnemann. And Dr. Batch was a very, very staunch follower of Dr. Hahnemann. He left London and his own popular practice and went in search of plants, which eventually became the Batch flowers of today. So he wanted this to be very, very simple. When you read the writings of Dr. Batch, he says that it should be so simple that you have to teach the opposite person what are batch flowers, teach them how to use it, teach them how to select it so that he can select for himself and he can select for others. This makes me remember of a Salman Khan movie in which he said that if I do something good, I do good for three people, and then I tell the people Tell one of that person that you do good for 3 people. So this chain goes on. This is what Dr. Bach also said, that keep the chain on and make it very, very simple. Don't make it complicated. Okay. His researches led him to recognize that there were clear personality types that related to various patterns of ill health, irrespective of physical symptoms. Physical symptoms could be anything. It could be migraine, it could be sinusitis, it could be arthritis, it could be GI reflux, or whatever. That is not important. As far as Bach flower remedies are concerned, along with the physical problem, look at the mental emotion of the patient. The physical symptoms being presented by the patient could be anything. Okay? So this is what is very, very important. By 1930, he was prepared to give up his successful medical practice in order to search for plants and trees that came to known as 12 healers. So out of the 38 flower remedies, the first 12 were known as 12 healers. Each flower was found to embody the positive and harmonizing force for a negative emotional state, be it fear, resentment, or despair. Now, friends, we all know that all of us have emotions like fear, anxiety, jealousy, uh, disgust, even fears, so much fear, terror is there, right? So these emotions are normal within us up to a level of moderation, but they become morbid, then there is a problem. And that's where batch flowers will come into existence. So, in order to transfer this healing force to a patient, Batch prepared essences from flowers intuitively. Now, remember, batch flowers were never proved like homeopathy. The main difference between batch flower and homeopathy is that batch flowers are only 38. Homeopathy is more than 3,000, 4,000 remedies. Homeopathic remedies are proved on healthy human beings. Batch flowers were never proved. Batch flowers were the intuitive feeling of Dr. Batch. Now, Dr. Batch had a spiritual and an intuitive feeling about what emotions could be covered. And even if you look at the plant, even if you look at the flower, you will know what is the characteristic of the person. It's so interesting and it's so intriguing. You will feel, how did he come to know about all this? Now, that requires a really spiritual kind of mind. Remember that. He found that as the negative moods changed, so the person could return towards health. That means he found out that whenever the person was in a negative state of health, be it anger, jealousy, grief, he came into physical ailment. So that is a mind, body, soul relation, remember. And as soon as the mind became okay, even the physical problem went. Dr. Batch explained the healing properties of the remedies in terms of philosophy of life that saw a person as much more than outward physical body that is to be treated by conventional medicine. Illness, he suggested, was a message from the inner being calling for a change in our way. Remember, whenever we have problems, imagine just a little cough we have, okay, or a little headache here and there, or little feeling of tiredness. We have to look at where we were disturbed, remember. And we'll find out that, okay, in the morning, something happened in the bus when I was traveling. Somebody pushed me, somebody fought with me, somebody argued with me, and then this thing has started. So, what we require is introspection, friends. We require introspection. So the primary purpose of the flower essences is to help us to change and bring us back to a genuinely happy experience of life. So what is important? The outcome is not cure. We are not looking at cure. We are not looking at whatever the problem was there. The outcome is happiness. If you are happy, you will not have any problems. It's so simple. Okay. The 38 remedies Dr. Edward Bach discovered in 1930s represent a complete system of healing. Remember, he has covered all emotions, remember, whether it is small as fear, as big as horror, as big as terror, as small as grief, as big as depression. Every emotion is covered by these 38 flowers. There is nothing in this world that cannot be covered by Bach flower. So Edward Bach, in only few years, from 1930 to 1938, imagine, he discovered Bach flowers in 1930 and he died in 1938 at a very young age of 52. Now, remember, in those 8 years, he has given us such a rich materia medica of Bach flowers. Dr. Bach found through his careful study and research that the disharmony within oneself was the root cause of the disease. For this reason, remedies from the system are always selected on the basis of our natural character, temperament, and state of mind. Each remedy is associated with a basic human emotion. Now imagine there is a remedy called mimulus. Now, if I have got today, if I had a fear of, coming on, maybe Dr. Abu Salam or Dr. Danesh thought that I was not coming. Maybe they thought that I had a fear of coming on the computer, coming and presenting. And if I really had that fear, that how am I going to face such doctors? Such learned doctors are here today. What am I going to speak? I will do, stammer in front of them. But if I had such a problem, I would have taken a dose of mimulus, remember. And that mimulus would have made me confident enough to talk in front of the learned doctors. So, mimulus, for example, is when we are anxious or afraid of something specific. Like a patient comes to us, coming with arthritis or whatever sinusitis, XYZ physical problem. And I ask him, tell me something about yourself. And he starts talking and say, Doctor, I'm so scared of crossing the roads. I don't know why. When I cross the road, I feel as if the vehicle is going to come and hit me. I also got fear of heights. When I look from heights, I feel as if I'm going to jump. I will die. Yes, I can think of argentum nitricum, my friends. I can think of aconite also. But it is so simple. Why go to argentum nitricum? Why go aconite when the nature has given the flower mimulus to us? One dose of mimulus will help not only the fears but also the arthritis of the patient. That is the miracle of batch. So taking this remedy helps us overcome our fear and face it with courage. Now, somebody who's got fear of dogs, now remember, will not go and hug the dog. Remember, we have to understand that. Somebody who has got an intrinsic fear of dogs and cats who doesn't want to touch them, he's scared of touching them. After giving mimulus, don't expect that he will go and hug the dog. This fear will be reduced. So whatever has gone to the extreme will come to moderation. And this is where it's just like homeopathy. We are not making him, so courageous that he can go and hug every dog on the road. We don't want to do that. But at the same time, the panic which was created with him, the palpitations which came due to seeing a dog and how he used to run away when seeing a dog, that will go away. So that is what the aim is. Remember. Okay. The remedies are in liquid form. Now remember, basically, I have also done my level 3 from Bach Center in UK, remember, recently. And now I am also a batch flower registered practitioner. Also, I am going to do a batch flower registered trainer course also so that I can train more and more people. Batch flowers are available very easily. The literature is available very, very easily. It's free on the internet. Dr. Batch has made it very, very simple. And I feel more than 90% of the people in India and all over the world, they have not qualified in a way or they have not studied, but they study from books and they are practicing bachelors in a very successful way. They are helping people. The first thing that I have learned is I have to keep my seat of homeopathy aside. A feeling that I am a doctor and you are the patient. So that gives me a feeling of strength. Okay, I am going to give you this remedy and you will be okay. I'm not going to say that. In batch flowers, we don't say that. We talk with the person like a layperson. We sit with the person like a friend. We understand what the person problem is. We give him some remedy and tell him that I think you require mimulus because you got fear of this. I think you require clematis because of this. I think you require rock rose because of this. Do you agree, my friend? And the person would say, yes, you're right. I think I need this remedy. Then only I will give him this remedy. This is the philosophy of batch. And I am not going to ask him, okay, you see me after 7 days, you see me after 15 days. I am going to teach him how to make batch flowers at home and also help others. Are you getting it? So when we are practicing batch flower remedies, we have to get up from the seat of a homeopath or a doctor and treat the person like a friend, treat the person like a fellow human being and teach him how to use the batch flowers. So that next time he doesn't have to come to you, he will study batch flowers, he will use for himself, and he'll help others. This is very, very important. Okay. Like Dr. Batch, we believe that healing on an emotional level has a knock-on effects on other level also. So treat him mentally and even his physical problems will go out. A healthy emotional life and a balanced personality will allow your body to find its own natural state of health. Remember, this is what even homeopathy does. Homeopathy is not curing of disease. Homeopathy is creating the vital force to be normal. And when the vital force becomes okay, even your disease goes away. We know that, right? The main reason, see, this is what Dr. Bach has said. The main reason for failure of modern medical science is that it is dealing with the results and not the causes. Remember how Dr. Hahnemann, he says, "Siset causa, siset effectus. Siset effectus, siset causa." Everybody used to say "Siset causa, siset effectus." Hahnemann was the first one who said "Siset effectus, siset causa." If you remove the effect, even the cause will go. Are you all getting it? Nothing more than patching up those attacked and burying of those who are slain without thought of being giving the real stronghold. Are you getting it? I mean, in the war, there are many soldiers who are dying. He gave the example like this. You will be taking the soldiers and burying them and throwing in new soldiers. But what is it? Are you going to win like that? You're not going to win like that. You have to strengthen yourself before. Remember. And this is what batch flowers do. It strengthens your immunity. Batch flowers were also used in much strength during the COVID pandemic, remember. Because COVID pandemic was all about fear, fear, fear. Fear I'm going to die. Fear my relatives are going to die. Fear what is going to happen to me. All the fear remedies, like first was mimulus, aspen, cherry plum, red chestnut, and rock rose, sorry. These five remedies for fear, they were the masiha for all the people who had COVID, remember. And we used it in COVID too much. Only the fear remedies. And when the fear used to go away, his immunity used to come up, his oxygen levels would come up, and he would be healed. Remember, this is how many people in COVID were saved because of batch flowers. Remember, of course, we gave aconite also, we gave hyosamus also, we gave stramonium also. Remember that. But along with this, batch flowers were also given. Rescue remedy was given. Remember, the rescue remedy is a combination of five flower remedies. And my friends, remember, whatever happens, whatever pathy we are practicing, I will pray to you. I will join my hands and say that please buy rescue remedy and keep it in your home. Whatever happens to you, to your son, to your daughter, to your wife, to your mother, please start rescue immediately. If someone gets a heart attack, he will survive till you go to the cardiology department, till you give them anti-streptolysin or whatever injection to save him from myocardial infarct. But keep rescue at home. Little drops of rescue in 1 liter bottle, shake it, let the person have it little sips, and he will go to a calm sleep. The person who's not sleeping, a lady who's in hysteria, a lady who's in menstrual pain, a lady who is pregnancy labor pains, a lady who's getting very, very angry, a man who's very, very aggressive, a man who's very, very tired. Give him rescue and you will get excellent results. So please keep rescue always with you. Even if you're carrying a bag and if you're going to the office, I carry rescue in my bag every day because rescue can really rescue. Remember that. So please, all of you, okay? The remedies can be made in tools. See, they are flowers. They are not potentized. They are not suckers. They are just kept in the water in the sun, and they are flower extracts. Remember, only one rock water is not a flower. Remember, all of them are flowers. So when we say batch flower remedies, only rock water is the water coming from the rock. That's why it is known as rock water. So it is not a flower, it's not a plant. But the other 37 are plants and flowers, remember. So either you can make it from the sun method, which involves floating of the flower heads in pure water for 3 hours in direct sunlight, or you can boil if the plant is very woody and it cannot, be kept in the water in front of sun. You can create it by boiling method, where the remedy maker boils the flowering parts of plant for half an hour in pure water. So this also you should know. Taking the right remedy restores the balance of the whole person, which in turn allows the body to make use of its natural ability to combat ill health. Remember, it's very, very important. Restores the balance to the whole person. I and only mission is to restore the sick to health. See how much similar it is to Hahnemann, because we are following Hahnemann only, remember. The remedies work well alongside other forms of treatment. So somebody who's saying, "अरे मैं तो मेरी heart की दवाई ले रहा हूँ, I'm taking my hypertension medicine, I'm taking this medicine, I'm taking that medicine." Okay, don't stop that. Don't taper it. Continue whatever you are taking. Take batch flowers along with it. It will not harm, no contraindication, no side effects, no interaction. Remember that. Okay. So the remedies work well alongside with other forms of treatment which focus on physical. So the client should seek appropriate help to relieve physical pain and discomfort. So if you've got infection or you've got bleeding which is uncontrolled, you will have to go to the doctor. You'll have to go to the surgeon, whatever. Don't expect back flowers to heal everything. The most important thing of a good doctor and a good human being is to know your own limitations. Remember, you can't say that I can do everything with flower remedies or I can do everything with homeopathy. We have our own limitations. We should accept them. We should know when to refer the patient. Remember, palliative treatment may be required to control physical effects of stomach ulcer. The remedies will help the person deal with the worry that caused the ulcer. So remember, hurry, worry, and curry. These I learned in my third year surgery. My surgeon, doctor, my teacher, he told me only the cause of peptic ulcer is hurry, worry, and curry. So this hurry and worry can be taken care by batch flowers, but curry cannot. You'll have to tell your wife to do something for the curry, right? To reduce the masala in the curry. Otherwise, batch flower will not help you in that. So hurry and worry can be treated with batch flowers, but not the curry, remember. So Dr. Batch categorized the 38 remedies into 7 groups, and we look them at like this, right? Like other forms of natural medicine, the flower remedies take effect by treating the individual, not the disease or the symptoms of the patient. They act on the emotions and work to bring the person's negative emotions back into balance. So, whenever you're reading any batch flower remedy, there is a positive aspect of the remedy and a negative aspect. For example, mimulus is a very, very important remedy for fear. Fear of known things, fear of dark, fear of alone, fear of dog, fear of cat, fear of jumping, fear of height. So these are the negative symptoms of mimulus. When you take mimulus, the fear slowly, slowly goes away and you develop a courage to cross the road, to go in the elevator, to go in a narrow space. That is the positive state of the remedy, remember. Okay? And just like in homeopathy, there are constitutional remedy and acute remedy. In batch flower also, there are type remedies and there are phase remedies, remember. Okay? So, of course, we'll talk about that later on because when Dr. Dhanesh and Dr. Abdul Salam told me about taking batch flowers, I told them that one session will not be enough. Okay, so we will have to repeat a session at some other time, provided you give me the permission. So maybe some other time we'll talk about the individual remedies. Probably 7 sessions on 7 different groups will be very, very useful for everybody. Isn't it? We each react in a different emotional way to the same physical illness. Now, remember, if you've got migraine, a person would say, "Oh, I'm really tired of all this. I don't want to suffer from this migraine. My whole life is gone. I'm so depressed. I'm so sad because of this migraine." Imagine another person getting angry and saying, "What is this migraine coming again and again? And why are you all disturbing me? What's happening here? I don't want you to come here. Close the door, close the light." So two people suffering from migraine come up with two different types of mental setups, right? For example, two people with arthritis are likely to feel two different emotions. One may be resigned to the illness. Abhi to mera kuch nahi hoga. Nobody is going to help me. Who is going to look after me? I have become old. This is one thing. The other person may become impatient. Don't touch me. I don't want anybody to look at. I am an independent person. I'll get up on my own. So the person could be impatient or the person could be resigned. So for these two people suffering from the same problem, my friends, two different batch flower remedies will be taken. So you have to go to the core. You have to be like a detective. You have to be like a CID. You have to become like a CBI. Find out what is behind the emotion. Don't look at fear. Fear के पीछे क्या है? डर के आगे जीत है, but डर के पीछे क्या है वो भी हमें देखना. We have to see that also. Remember that. Because until unless you find out what emotion behind the fear, all the patients you will be giving mimulus only. But remember, behind the fear was also anger. Behind the fear was also impatience. So there are so many remedies which are a core of that. Remember. So don't just look at the core. Don't look at the face value. Don't look at the symptom directly. Try to find out कहाँ से ये symptom आ रहा है. Where is the symptom coming? The effect of taking the remedy is not to suppress. Remember, if you just give it for fear, it will suppress. but try to find out behind the fear. What is the problem? Why is he scared of? What is he scared of? Since when he's scared of? Remember, is not to suppress negative. He's one of my patients says that since the death of my mother, I'm scared of everything. So the thing was the core was his grief. The core was his sadness. It started with grief. It started with sadness. It started with missing the mom. It started with मैं मेरी मम्मी के सिवाय कैसे रहूंगा? How can I live without my mom? So instead of just giving him mimulus, I thought of giving him some gores. I thought of giving him some walnut because he was not able to adjust to the transition that his mother went away. Remember, are you getting it? So don't just look at the face value of the symptom, go behind it. People do not have to be physically ill to benefit from these remedies. Throughout life, there are times when you feel tired, stressed, and at these times, the flower remedies can restore one's emotional balance before the symptoms of physical illness appear. Remember, every time before the physical illness appears, there is always a syndrome which is known as prodrome. Okay, whenever we are going to get malaria, whenever we are going to get typhoid, whenever we are going to get diarrhea, maybe you get the diarrhea in the evening, but the whole day you're feeling, oh, I'm feeling tired, lethargic, body pain. This all happened because that guy fought with me in the morning and I could not fight back. You could think of surface agria, but you could also think of other homeopathic and batch flower remedies also. To catch the illness before it really comes into the functional level and structural level. So catch the person in prodrome when the fever has not started, when the diarrhea has not started, catch the person there. This is very, very okay. As we said, there are 38 different batch flower remedies, each supporting you in different way. For example, mimulus will help you with known fears and worries. Gores will help you with feelings of despair and hopelessness. Remember, for depression, hopelessness, and despondency, gores is a very, very important remedy. As such, if you look at gorse, mustard, gentian, sweet chestnut, and wild rose, these are the 5 remedies for sadness and depression, depending on the intensity. Remember. In the outside market, even in abroad, when you go to US, UK, you get a lot of combinations where all the remedies are added. It doesn't work like that, my friends. Remember, we all agree that homeopathy also, somebody makes a gas mixture, carbovate, China, Nux vomica, natrum sulf. Does it work? It will not work like that until unless you catch the right emotion, catch the person wherever he needs to be caught. That is where it. So Dr. Batch put it rather beautifully when he said, I am hungry, I will go and pull a lettuce from the garden for my tea. I am frightened and ill, I'll take a dose of mimulus. It has to be so simple, remember. I am hungry, I will eat a tomato. If I have got fear, I will take mimulus. This is what he wanted the batch flowers to. So we are not here to make batch flowers difficult, complicated, so that people start coming to me and saying, "Oh, Guru, teach me batch flowers, teach me batch flowers." No, I am also less like them. I am going to teach them. They are going to learn and they're going to teach others. So this is the philosophy of batch flowers. As I have told you, we have to get up from the seat of authority. Remember, batch flowers cannot be treated or batch flowers cannot be given from a seat of authority. They have to be given on a seat of friendship, from the seat of love, from a seat of sharing, from the spirituality aspect. Remember, the more spiritual you are, the more ideally you will be able to practice batch flowers. Remember, batch flowers is all about spirituality, which we most of us are not. We are all materialists, but we need to be spiritual. And I think taking batch flowers on your own, trying to find your own emotions, introspecting yourself, taking a mixture of batch flowers for your own self is the way to become a batch flower practitioner. Until unless you experience batch flowers, you cannot be a batch flower practitioner. Remember, somebody who has taken cold water on his head in winter knows what is cold. All of us are used to take hot water, warm water in the winter, but there are people who take cold water on their head. He knows what is cold. So experience it first, my friend. This is what, remember, Hahnemann told Herring also. When Herring was employed to criticize Hahnemann specifically, because he was very good critic, Dr. Constantine Herring. So what did Hahnemann tell him? Okay, criticize me, but practice on your own first. Prove that I am wrong, and then you criticize. Practice on your own. Okay, that is nota bene. That is what is written NB, nota bene. Remember, that is what Hahnemann told Herring. Remember. When are the what are the situations when you can give batch flowers? Remember. First of all, when you are going to a hospital or a surgery or a dentist, that is the time when we are really, really, really scared. We don't know what is going to happen. We don't know what that dentist is going to open our mouth because the whole thing is so terrorizing. We are told to lie down flat and open our mouth, and there is a big light on us, and we don't know what the dentist is going to put on our mouth, where in the corner of the mouth is going to go. So there is a lot of fear and terror. Remember. So mimulus, aspen, rock rose, cherry plum, red chestnut. Now, if my son or if my daughter, she's going for a hostel and she's going to stay there, and I keep her calling, hello, how are you? Have you reached? Have you eaten your breakfast? Have you eaten your lunch? Have you eaten your dinner? Did you take cover when sleeping? Is there fan? Is there AC? Are there mosquitoes? I, as a father or I, as a mother, would require red chestnut because I'm constantly worried about my daughter, constantly under the fear what will happen to her. So, red chestnut is for fear of somebody whom you love, concern for somebody you know, but over concern, just like Kalikab and Dalkamara. Remember, our Kalikab and Dalkamara are also like that anxiety, care for others, too much. Vanilla, care, too much for others. Therefore, many a times with a Kalikab, I have given red chestnut also. Can you imagine Kalikab and a red chestnut? Causticum and a red chestnut. Great combination. Not together, but give separately, and they will do their own work, remember. Okay? So when you're scared of going to hospital or a surgery or a dentist, second is caring responsibility, looking after your old father, looking after your grandmother, looking after your child, looking after your newborn. Is he sleeping? You are not able to sleep because your son is not able to sleep. Think of red chestnut. Remember, very very important remedy when you are ill because of somebody else. You're ill because of your loved one. Think of red chestnut. Always thinking about it. Workplace stress. Always thinking, now I have to go in front of my boss, what he will say, being impatient, being intolerant, getting angry, jealousy. Very, very important. Corporate world, there is so much of jealousy, so much of competition. How to put the other person down. Always planning, manipulative, deceitful. Think of remedies like holy, remember. Jealousy, suspicion. Very, very important in the corporate world. Competition is there. You are becoming intolerant. You become angry. You can think of beach remedy, remember, for intolerance. At the same time, your boss could be very, very dominating, or you yourself as a boss could be very, very dominating, always saying my way or highway. Either you follow or you get lost. This is what I'm saying, and it has to be followed. Think of a remedy wine. Remember, Vine, wine. Very, very important remedy for highly dominating people like our lycopodiums, dominating people like our Cuprum metallicum, like our maybe Kalika, dictatorial, very, very dogmatic people. Remember that. Not sleeping. Doctor, when I go to sleep, there are so many thoughts coming in my mind. What to do tomorrow? How did my life go? These thoughts don't allow me to sleep. Yes, think of natrum mur, but also think of white chestnut for repeated thoughts. And in fact, nowadays I'm thinking of how to apply this repeated of white chestnut into physical ailments. So when a mother brings her child saying, my child has repeated infections, repeated tonsillitis, repeated headache, repeated fears. When I see the word or hear the word repeated, I think of white chestnut, white chestnut, white chestnut. That's how you can apply the philosophy of batch flower mind into the physicality. White chestnut is for repeated thoughts which will not give you sleep. What if the problem is repeating again and again? So, chronic problem, the first remedy you can think of is white chestnut. Somebody who's coming up with chronic headaches, chronic skin problem, think of white chestnut. This is a very, very important tip. Please follow it. I have been using it for many, many years and you will be successful. Remember, such tips are useful more than homeopathy because many a times homeopathy will miss, but bachelor will not miss. Remember, I am not anti-homeopath. I am myself a homeopathic doctor. But the most important thing is find out something that you can You can go to the core of the patient faster, heal him faster, rather than making a big show of yourself that I'm a big homeopath, sit in front of me, now I'll write your case, then you do this, you do that. No, just find out the emotion and take care of the person. Menopausal symptoms. What happens in menopausal symptoms? Can somebody tell me what happens in menopause? Yes, Dr. Ajini, can you tell me? Menopause. What is menopause?
Menopausal symptoms like hot flushes, tiredness,
Uh-huh.
irritation. Uh, some people will have a headache, uh, backache.
So
Um,
how can you think of a batch flower remedy in menopause? Which batch flower remedy?
mm,
What is menopause basically? Remember, what is menarche? What is menopause? What is pregnancy?
change.
What is
It's a,
lactation?
it's a,
Okay, very, very good. So it is a transition.
yeah.
It is a transition. The woman was menstruating normally, and now slowly, 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 her menses are going to stop. The hot flushes, do they have any control? No, they can come anytime. And she says, I don't have control on this. The hot flushes come and I get so irritated. I become so intolerant. I want cold air. I want AC. So, what are the three symptoms here? First is a change. So, the remedy is walnut for transition. She is not able to adjust. So, first remedy you have to give is walnut. The second remedy, she has become intolerant. Think of beach because the key word of beach is intolerance. And the third thing is uncontrolled. Wherever there is a lack of control, loss of control, wherever the word control is there, think of the remedy cherry plum. Remember that. C for control, C for cherry plum. Remember that. So when a small child is passing urine in the bed and the mother says, "Oh, he's not having control of the urine," give cherry plum. When a person of Parkinsonism has uncontrolled trembling of his hands, no control over walking, no control over sitting, think of cherry. Are you getting it? So this is how you can apply the mind philosophy of batch flowers into the physical sense. Traveling on planes, trains, car, I told you. Again, there is a change. Again, there is a fear. Again, there is lack of confidence. Pregnancy, again, is a transition, remember. Exam and interview stress. Again, stress is there, lack of confidence. Coping with physical illness. So there could be depression. Remember, somebody having a cancer. Still, that person with cancer will say, no, no, I will still go to America and I'll find out. So he still has hope, remember. But somebody who has cold and cough, he'll say, no, I'm hopeless. These are the different types of individuals that you see. Somebody who's having cold and cough will be hopeless. Somebody with cancer will be very, very hopeless. So you can think of various remedies of depression like gourds, mustard. Today is not the time to talk about individual remedies. I'm just trying to give you the introduction of bachelors. Remember, at some other time we'll talk about different remedies and how to differentiate them. It's very, very okay. So these 38 batch flower remedies are simple natural tools which help you to balance how you're thinking and feeling, good for helping and quickly restoring an inner sense of balance. Batch flower remedies can help you to bring harmony and balance, help you to deal with emotions and difficulties of daily life in more balanced way. They can be used individually or mixing. You can mix up to 6 flower remedies in a single container, remember. Up to 6 you can mix. If it goes to 7 and 8, then it's better to take 2 different bottles, but don't go up to 7 and 8. Try to find out the core. When you read the batch flowers, you'll feel that the patient has all the emotions, but don't give them all the remedies together. Second thing is there is nothing like come after 7 days, come after 15 days. Tell the patient that you have this fear. If you feel that the fear is less and it is better now, stop the remedy. Because once the emotion goes, batch flower becomes like a placebo, remember. So you cannot tell the patient that, okay, take the medicine and come after 7 days because he may be better in 1 hour also. So tell the patient to call you up and tell him how he's feeling. It's very, very important. It's not like homeopathy. Come after 7 days, come after 15 days, come after 1 month, no, nothing. Okay. So you should be in constant touch with the patient. That's very, very. It can be used by adults, children, pets. Very, very important. Just now there was Diwali, and many of us have dogs and cats at home, and you saw how they are terrorized by the cracker noise. They go and hide and they're trembling. Think of rock crows. Very, very important. Terror. Mimulus is only 1% of rock rose. Remember that. Rock rose is a tremendous terror and panic which these animals get when there is a cracker bursting. How they tremble, how they go under the sofa and hide. That is rock rose. So give your animal rock rose for panic. Okay. As rightly said by Dr. Edward Bach, there is no true healing unless there is a change in outlook. How he perceives the disease is very, very important. That is what Dr. Shankaran taught us. Delusion. Delusion is nothing but a false perception of the disease. My mother-in-law is not good. She's always after me. She tells me, do this, do that, do this, do that. And after giving the remedy, whether it is homeopathic or Bach flowers, the same lady comes and says, I don't know what happened to my daughter, my mother-in-law. She has become very nice. She's talking very nicely to me. She is not doing the same thing again and again. Was the mother-in-law a problem? No, mother-in-law was not a problem. The problem was how I was perceiving her. The mother-in-law was saying, "Okay, have tea, eat the tea. Don't eat the chapati just like that from the fridge. Make them hot and eat." You used to feel that she's torturing you, she's troubling you, but she actually cared for you. Now you can see the care aspect of your mother-in-law. That time you felt that she was a villain, but she was not a villain. Okay, so that changes your perception, and when your perception to the problem changes, even your disease goes up. So the lady was coming with a lot of migraine, and her problem was her mother-in-law. But when she was treated for her perception, her migraine also went away, and her perception to her mother-in-law also went. But the problem was the solution was change of perception, and then the headache went. Okay, so that is all about flower remedies. These are the 7 categories. First category is fear. Second category is uncertainty or lack of confidence. Third is insufficient interest in present circumstances. Fourth is loneliness. Fifth is oversensitivity to influences, despondency and despair. And last is overcare for the welfare of others. Okay, so that finishes my small presentation on Bach flowers. I have purposely not gone into the individual things about Bach flowers, which we can have at some other session. Today, I just wanted you to understand, and I'm sure you all know this, but maybe a little bit of change of perception for you also, for me also. I'm happy to be a part of this IFPH. And thank you, Dr. Ajini. Thank you, Dr. Ganesh and Abu Salam.
Thank you so much. Actually, it was a wonderful presentation. We all know, we heard about Bach flower remedy, but this is what you said is, I think it's a scientific explanation about the Bach flower remedy. We heard about this remedy is good for this thing, that thing, like that. But you have mentioned from the beginning, it's a wonderful session. And now I'm inviting doctors. Those who have questions, please ask your questions to Dr. Chaukkar. And we have some questions in the chat box, Doctor. Can you go through that and answer it?
Yeah.
Dr. Nishu.
Are you able to read them, ma'am? Can you
Yeah,
please
I will read. Does homeopathic medicine also prescribe multivitamins and sleep medicines? Why it lacks sleep medicine?
Who? Homeopathy?
Yeah, does homeopathy medicine also prescribe multivitamin? Nishu, if you are, please hand raise. You can ask your question directly to doctor. And one more question, sir. Bach flower remedies are good emotional cause of disease. Please tell us about Bach flower remedies for insomnia, OCD.
Insomnia is because of what? Ask the patient. मुझे नींद नहीं आती. I cannot sleep. Why you cannot sleep? Because my boss always keeps on talking to me and I'm always thinking. So many thoughts coming in my mind. The best medicine for insomnia is white chestnut, remember. Repeated thoughts. In fact, in UK, you get a combination of white chestnut and rescue, which is known as night drops or sleep drops, remember that. So if you can take rescue remedy few drops in water and white chestnut in water and sip it in the night, you'll have a very, very peaceful and calm sleep. 99%. I am saying it with a bang that it is 99% that any and everybody will sleep until unless the cause is structural, remember. Cause of Insomnia, if it is structural, then we'll have to think about it. But if it is functional, I'm sure he'll go to sleep. Second thing is vitamins and everything is not required, sir. Vitamins are there in our food. The problem is whatever we eat is not assimilated. We don't require vitamins. Vitamins, they are, pharmaceutical mafia, remember. This is pharmaceutical mafia which is created. The vitamins and enzymes and this and that, don't take that. If you are having good food, if you are having good digestion, if you are having good sleep, if you are having no tension, I mean, tension is everywhere, stress is everywhere. But if you are doing yoga, if you're doing meditation, you don't require any vitamin or anything. So homeopathy, there is no vitamin. Neither you need to take vitamin from outside. Okay?
And Nishu was asking medicine for OCD also. That also
OCD.
repeated thought. That will come under the same remedy,
Yes,
right?
very, very good, very good, very good. But there is one more remedy for OCD which is very good, and that is crab apple, remember. So crab apple and white chestnut combination is very, very important because OCD, the feeling is that I am not good enough, I am dirty. They'll keep washing their hands. They feel as if there is some dirt in them, and therefore crab apple is a very, very good remedy for bad self-image. I am not good enough. Remember our remedy lac cananum in homeopathy. I am not good enough. So it is a good remedy post abuse. Remember when a child or when a lady is abused in her childhood and still she has that feeling of being dirty, she's not allowing anybody to touch her. Think of crab apple. For acne, pimples, crab apple. Remember, because when a person says, कुछ भी करो पर ये मेरा pimples को ठीक कर दो, take them out. Take the psoriasis patch out of my hand. Get rid of it. When the person says, get rid of it, crab apple. When the person says, I feel I'm dirty, crab apple. Okay? So remember these two things. Very, very important.
Okay. Anyone else? Hello.
They have all
Okay.
become.
We have questions, sir. Which batch flower is most effective for nose blockage?
Now, these are the questions which I really don't like. I'm sorry, madam or sir, whoever has asked. I told you, patch flowers are not for physical problems. Nose block or nose running, hair out or hair in. There is no remedy for that. Ask the mental emotional state. With the nose block, are you feeling irritated? Are you feeling depressed? Are you feeling angry? Are you feeling sad? These emotions will help you in the nose block. So there is no remedy for nose block, but how you feel during the nose block. Are you irritated in nose block? Think of beach or think of Holi. Are you feeling very sad and depressed? You may think of gorse or mustard. This is how batch
What
flowers
is
are.
that?
Gorse or mustard. There are many other remedies for feeling sad, remember. Sad.
Okay.
So somebody is asking me, what is the remedy for PCOS? What is the remedy for migraine? What is the remedy for arthritis? There is no answer for that, isn't it? So,
Sir, OCD of over curiosity.
still crab apple. I'll think of crab. But why this over curiosity? No more, no more, no more. Isn't it? They want to know more.
How to control ADHD?
ADHD is again hyperactivity. So there is a remedy called impatience. Remember, impatience. Okay.
Impatience, yeah.
So you can think of impatience, you can think of vervain for hyperactivity. For lack of concentration or lack of focus, you can think of chestnut bud. Very, very important remedy. I use it too much in autism. Remember, my specialty is autism and ADHD, and I use a lot of impatience. I use a lot of vervain. I use a lot of chestnut bud. I use clematis. Remember, clematis people or children are like Tare Zameen Pe. Have you seen the movie Tare Zameen Pe? The small
Yes.
child with dyslexia, when the teacher is teaching, he's looking outside at the sparrow. He's completely absent-minded. So he's not attentive to what is going on. He is somewhere in the future. What will happen? What should you? That is clematis. So clematis is also an important remedy for daydreaming in children. Remember, those who are not writing from the board, who are not, when the teacher will ask, and they'll say, "Huh? What?" Something like that. So they are not there wherever they are supposed to be. There are
Okay.
many people who are coming now. I think they are very late. I don't know. They don't know the time or what. I think they are coming early for the next session. Maybe. There is a Malayalam, no? After this.
Yeah, Malayalam session.
I have to learn Malayalam so that I can come in Malayalam session also.
Very happy to hear that.
At present, I know only Sherry. Sherry in Malayalam.
One doctor named
Yeah, Danesh, tell me.
Dr. Gopi Krishnan. He's always talking about this bachelor remedies, and he has taken more than 15 sessions on the bachelor remedies.
Very good. We need to learn from him. Maybe we should call him next time. I would love to learn from him.
And in Malayalam, sir.
On Malayalam. But at least the remedy names will not be in Malayalam, no?
And
It's a
one
white
more question.
serum, isn't it?
One more question. That is how to dispense the batch flower remedy.
That's a very, very important question. Normally, what I do is I make a stock bottle. Stock bottle means a 30 ml bottle like this. If this is a 30 ml bottle here. 30 ml bottle, I'll put distilled water or pure water in it properly. And after putting I'll take the indicated batch flowers, maybe 2 drops in this, and shake it properly up to 5 to 6 remedies of all the emotion. Shake it properly and 4 drops 4 times in a day or 5 times in a day. 4 drops 4 to 5 times a day. If the situation is acute, I will not make a bottle like that. I'll take the bottle directly and put 2 drops on my tongue.
Okay, tincture. This is.
It's not a tincture, of course, but it can be said as a mother substance. I mean, water and the combination of all these together. So,
anyway, now it is time for the Malayalam session. It was wonderful session, and we want to hear more from you. And I am inviting Dr. Abida Salam from Qatar for giving out of thanks to Dr. Samir Chaukkar. Dr. Abida Salam, you are welcome.
I have one of my friends from Turkey called Sevgi here, Sevgi Postoglu. She's a very good friend of mine. She's a very good friend of mine from Turkey.
Yeah, she's also here.
Hi, Sevgi. How are you?
I will unmute her.
Sorry.
Please
Thanks for me.
Hi, good evening. Thank you.
Good evening, Sevgi. How are you? How are you?
Fine, and I'm very happy to see you and to hear some things about batch flowers. I must learn this. Thank you.
I took a seminar on batch flowers of 3 days in Ankara recently. Last 2 months back, I was in Ankara. I did a seminar. Really? I think the next session is going to start. So, bye-bye. Thanks, Sevgi.
Bye.
Wait, Dr. Abida Salam, you are welcome for giving out of thanks to
Good evening. Good evening, doctor. And thank you for your valuable session on bachelor remedies. Thank you for your valuable time you're spending with us on behalf of IFPH and on behalf of myself. A heartfelt thanks for you and to all the participants who have been attending the session till now. Thank you.
Thank you. Namaste. Bye-bye.
Thank you, Dr. Abida Salam, and thank you, Dr. Samir Chaukkar. So we are winding up the session. Bye-bye. Good night.
Bye-bye.
I'm inviting Dr. P. Shaila for moderating Malayalam session. Dr. Shaila, you're welcome. Please.
Bye-bye.
Bye-bye. Good night.